Hi. My name is Ikramuddin Khan. I'm a physical therapist doing my doctorate in physical therapy with ATSU University. Today, as part of the week 3 assignment, we are presented with a case scenario of a 38-year-old patient who was involved in an MVA and has some shoulder, elbow, and wrist limitations. So we would be performing some joint mobilization on the following joints for the shoulder, elbow, and wrist. So here's my daughter. She's 10 years old and she has volunteered to help us out for the purpose of this assignment. The case presentation is the patient who sustained elbow fracture after the MVA has been casted for 7 weeks after the ORIF was done. And after the removal of the cast, patient presented with shoulder abduction limitations of 90 degrees, shoulder flexion at 90 degrees, internal rotation at 30, internal rotation at 60, and external rotation at 30. Patient also has subjective complaints of pain and more pain in the wrist, elbow, and shoulder. So we'll begin with our shoulder mobilization, starting with the shoulder joint first. So starting with the shoulder flexion, we will start with mobilization of the more proximal joint, starting with shoulder. We'll be doing mobilizing the glenohumeral joint, more precisely the head of humerus in the posterior direction. As the patient does not have more pain, but more lack of range of motion, we will be doing the posterior drift of the oscillations of the glenohumeral joint to increase the flexion. We'll start with grade 3 mobilization, which is large amplitude into resistance up to the point of resistance, and grade 4 are small amplitude oscillations well into resistance. For now, we will be performing the shoulder abduction. As the patient has lack of shoulder abduction, which is limited to 90 degrees, we will be performing grade 3 and grade 4 mobilizations of the shoulder joint. And in this situation, I will be stabilizing the right shoulder with my right arm, and with my left arm, using my web space, I will be putting directive forces right underneath the acromion process, pushing the shoulder joint in an inferior direction. Starting with grade 3 mobilization, performing 10 mobilizations. These are grade 3, large amplitude. And now moving on to the grade 4, small amplitude, well into resistance. Now we will be performing the shoulder internal rotation, as the patient also has limited internal rotation to 60 degrees. We will be performing positioning the shoulder joint into the max available internal rotation into the resistance where we feel the most resistance, and after that stabilizing the arm and mobilizing the shoulder glenohumeral joint for the proximal part of the humerus into a posterior direction. We'll be performing grade 3 and grade 4 mobilization, starting with grade 3, our small amplitude. Forgive me, grade 3 is large amplitude. And moving on to progressing further to grade 4 mobilization, which is small amplitude, well into resistance. Moving on to improving the shoulder external rotation, we will be performing grade 3 and grade 4 mobilization. I have pre-positioned the patient in prone and with the support of my thigh, placing the shoulder in external rotation. I'll be performing anterior glides, grade 3, large amplitude, grade 4, small amplitude, well into resistance. Moving on to improving the elbow extension as the patient is complaining of pain, we will be performing grade 1 and grade 2 mobilizations. And placing one arm on the oblique arm process, placing the wrist in supination. I'll be performing grade 1, small amplitude at the beginning of the range. Grade 2, large amplitude, free of resistance. Now moving on to the elbow joint, here again we are performing the elbow joint flexion for the restrictions. For this we will be performing a physiological flexion. Holding my both hands close to the elbow joint line, I'll be performing a distraction of ulna and a flexion. Distraction and a flexion. Distraction, flexion. Now moving on to the improving supination at the elbow. Again we are performing the grade 1 and grade 2 mobilization as the patient has subjective complaints of pain. For this we will be performing the anterior posterior glide right over the head of humerus, head of the radius, and we are performing grade 1, which are small amplitude at the beginning of the range. Moving to grade 2 mobilization, which are large amplitude, free of resistance. At the same time, I'm making sure with my right arm, right hand, to maintain the wrist in supination. Now moving on to the wrist joint, for improving the wrist flexion, I will be performing a posterior glide on the wrist joint, stabilizing the forearm and mobilizing the wrist, the carpal bones up in a posterior direction. I'll be performing grade 3 and grade 4 mobilization as the patient does not complain of pain but more stiffness. Grade 3, large amplitude. Grade 4, small amplitude, well into resistance. Now moving on to the improving wrist extension, I will be performing an anterior glide on the wrist joint. The carpal bones are mobilized anteriorly, performing grade 3 mobilization, large amplitude. Grade 4 mobilization, small amplitude, well into resistance. For improving the radial deviation of the wrist, I have pre-positioned the patient, and by stabilizing the forearm, I will be moving the wrist joint into radial deviation and performing grade 3, large amplitude, grade 4, small amplitude, well into resistance.